The COVID-19 pandemic has shown us that all countries need vaccines, but not all can produce them. BioVac, a biopharmaceutical company and established vaccine manufacturer based here in South Africa, says it's vital that we produce our own vaccines rather than relying on medicine imports. Let's discuss this in terms of the kinds of benefits that come with producing our very own vaccines. Dr. Morena Makwana, CEO of the BioVac Institute, joins me now for this conversation. Dr. Morena, thank you so much for your time this evening. A very good evening to you. What has certainly become so clear for us as South Africans during this COVID-19 pandemic is that intellectual property is one fundamental currency that is needed, especially during a time where everybody's trying to get access to what we have. But I just wonder, when it comes to the South African context and even perhaps even continentally, how do we become better prepared in terms of even what we can offer the world and the West instead of what the West and the world can offer us?
No, thanks, Faith, and thanks for having me. I think your introduction in terms of reminding us about COVID, I think is a very important. I think whilst the numbers are low in South Africa, we should not forget that we're still in a pandemic, and that with these variants, things can really turn for the worst. But I think we also need to be reminded that there is also, another public health emergency, being monkeypox, that the World Health Organization has now, they were worried about it, but now it's turned into an emerging concern. So essentially what that means is that, whether it's the next virus, whether it's the next variant, that the world is not anywhere close to getting rid of these pathogens, these viral diseases. And for that, we should just take what happened with COVID-19 and Africa in particular not being self-sustainable from a vaccine accessibility, with import bans and all of that. And this essentially means that we should be self-reliant. Now, coming directly to your question is that, there is minimal capacity on the continent. There have been quite a few announcements that have been made in the past 18 months around countries wanting to revive vaccine manufacture. But vaccine manufacture is a long game. It's very expensive, and it needs long-term commitment. It needs deep pockets, but it also needs a lot of risk that investors need to take around that. And around that, the short answer to your question is that we need an enabling environment, quite frankly. Not one party can really do it. We need, we need the private sector to come through, but we also need government to make sure that it has an environment in which investors can come in. Why are things now in the north? Why is everything happening in the north? I think we should ask ourselves that question and say, how can we address it, and how do we enable an environment locally?
Yeah, that enabling environment, Dr. Morena, also requires collaborative effort amongst member states, right? So within the African continent itself, we should be able to share resources, share knowledge systems, even indigenous knowledge systems. But sometimes it appears as though we're so fragmented within our efforts as well, that's why we find ourselves being beaten, and oftentimes by intellectual property, by resourcing, is because Europe stands together. The EU is a typical example. America stands together, but then when it comes to the continent, just the collaboration from an IP perspective, resourcing perspective, from just even doctors working with each other, it seems as though we're just not getting it right. And I just wonder, what is it about our continent that we're failing just to work closer and more collaboratively together? Because I can imagine a situation where the continent says, hold up a second, we will manufacture our own vaccines, we will have our solutions to our own problems. That could take us a long way.
I couldn't agree with you more, Faith, but I think that the issues are even deeper than that. I think one of the things that the continent and countries, including our own, one of the things that we're not used to is to take long-term decisions and invest early and invest continuously. I think what we often see is a very reactive approach across the continent when it comes to healthcare issues, when it comes to issues around climate change. Just need to see the disasters that are happening. And coming closer to healthcare issues, we've seen Ebola cases that has exposed, healthcare systems that are essentially weak. So I think there is a culture that needs to change about long-term investments, and for governments regardless of the administration change, making sure that there's systematic long-term investment in being proactive. Now, being proactive is the best. It's like having an insurance. Having an insurance on your car doesn't mean that you're aiming to have an accident. It just says that in case there's an accident, I want to be covered. And that's the mindset that we need to have when you look at healthcare, about healthcare systems, about hospital readiness, and coming back to our sector, that is what we need to have. We need, for vaccine manufacturing to happen, we need to have a few things right. Firstly, we need to have investment in research, and that can happen even at universities. And with that, the intellectual property will come and it needs to be invested. But the universities need to then give somebody that vaccine that they would have developed so that it can be commercialized. And that is only the private sector. Now, the private sector needs to firstly exist. And how do they exist? They need to exist in an environment where governments can say, I want to buy from you, my local partner. And we want African governments to buy from us. We want African regions to buy from us. That you're already starting. And this is not really about just selling one vial that would go into a jab. That is very important, and we're very proud of the work that vaccines are doing. However, there are many positive spin-offs. You have spin-offs in that you have a biotechnology sector that gets enabled. You have benefits to the economy. And this is exactly what I think that African governments should start thinking about. Really start thinking long-term. You won't see the benefits in a year, but certainly in 10 years' time you will. The unification that you're talking about is something that is extremely important. Africa in itself was extremely donor dependent. Well, it still is from a vaccine perspective. I mean, most of African countries get vaccines by donor funds. They need to at least spend a dollar towards buying those vaccines, and they need to buy local. And we need to make sure that, they invest locally and they support the local industry. We talk about the US. You mentioned the US. We have Silicon Valley. Silicon Valley just didn't come up after 1 or 2 years. There's a whole machine that was brought into decades and decades and decades, which is why we today have the Microsofts, the Facebooks, and all of those others. And the biotech and the vaccine world, there's nothing stopping us from developing that, provided that the environment is fertile for us to do that.
And very quickly, Dr. Morena, has the South African government and the healthcare system actually learned something from this pandemic? Have we actually taken lessons that we can implement?
South Africa is, I must say, not as bad as, call it, the other continents. Well, firstly, in terms of how it reacted, and I know that there's a lot of criticism, but things could have been much worse. South Africa had at least, the funds to buy their own vaccines. Now, unfortunately, because our industry was not that developed, we were able to only attract tech transfer. We're not able to develop the vaccines, but we're able to get tech transfers. But the fact that companies like ours exist essentially is a little bit better than how other African countries are. But there are things that we still don't have, Faith. As an example, we don't have yet the ability to manufacture from scratch. That's something that we're working hard in. So at the moment, we manufacture on the downstream side. So we have to rely on partners, multinational partners that we've worked with. And they've been very good and they've been very kind to us in partnering with us. But the end game is to really make sure that we manufacture from scratch. But for that, we need to make sure that the local environment is supportive of us to do that. And so, it's a mixed bag in terms of where South Africa is. There are some things that we have, some things that we don't have. But I think what is important is that the little that we have, we should make sure that we don't go back and think that, oh, well, the pandemic is gone. We can then, life can go back to normal.
I hear you loud and clear. We'll leave it there for now. Dr. Morena Mokwana, who is a CEO of the BioVac Institute. Thank you very much for your time this evening.